With all that being said, when it comes to my profession in physical therapy, there's actually a little bit of a light at the end of the tunnel, or a silver lining to this big cloud we're talking about. I kind of feel that when it comes to the healthcare providers, physical therapy could be in the most dynamic area. It can, being a physical therapist, I can evolve my practice from seeing people who have injuries and seeing people who need insurance and seeing people who are coming off of major problems and doing their rehabilitation to get them back to what we call steady state or a normal environment. But the way healthcare is moving now is they're going to force us to discharge these people before they reach their full potential of rehab. What excites me about that is that then opens up another business model, and that business model is the post-rehab model, where I as a PT can continue taking you on that path back to full health. But now I can say, it's going to cost you this. It's going to cost you, it's going to be an open market environment, whereas if I'm a better physical therapist, I should be able to get a premium for my services and help that person. If they want to hasten their recovery, they're going to go to the better physical therapist, and it becomes a consumer-based model. I like that idea, because what it then does is that myself as a clinician who've been around in healthcare for 20 plus years, who've done numerous different things to differentiate myself clinically, I can use that as a sales model to actually tell people, hey, I'm better than most. In society right now, you hear it all the time. You hear people talking about, I'm the best personal trainer, I'm the best physician, I'm the best car dealership, I'm the best grocery store, I'm the best number of things. This is the best drug for you. And what they're doing is they're marketing their services in a way that tells the consumer that this is what they need to do, this is the best program for them. In healthcare, we seem to feel that cheapens our practice if we actually say those words, I'm the best at what I do, and actually market what we're doing. I kind of feel sometimes we have to learn from the chiropractic model, where the chiropractors are out there, they know that they have to hustle and create a business model. There's not these large hospitals they can come out of school and go work for and almost be sheltered from the real world. Our profession and healthcare in general has been sheltered from the free market model. I think that's been a huge mistake. I think that this is forcing us to start thinking outside the box, start thinking more dynamically, to start looking at our profession as something that can be a moving target and can actually differentiate us from others. And also, the idea is how do you make your practice multifaceted? How do you make it so that the revenue streams come from many different sources, not just a third-party administrator or a third-party payer that tends to pay me based on their fee schedule. It's one of the few business models where I can do business with you, but a third person determines how much I'm worth. That's just not right. That in no way, shape, or form is that business something that you would see on Wall Street. That it just doesn't make sense that way. And it also allows this model, this boutique model, this specialty model, allows us to go out there and still compete with large companies, because people like the idea of coming to kind of a smaller location, a location that gets more hands-on, gets more one-on-one care, and it also allows us to move into the wellness model. There are athletic, there are sports performance people, there's personal trainers, there's a lot of people out there that have 1/5 or 1/20th of the education and skill set that I have, that are out there making six figures doing performance training or rehabilitative services in therapy or any form of personal training. In my mind, if our profession starts to look at that as a model they need to get into, it will benefit both ourselves, both from a financial standpoint, a practice standpoint, and also benefit our clients and patients in a way. They will then have access to us in a way that access to a professional that can do all the things from soft tissue work, which they're now going to a massage therapist or Raw for anyone else for, strength training, which they're going to a personal trainer, a yoga studio, that kind of thing. And then all of a sudden having the background, the musculoskeletal knowledge, the exercise physiology knowledge to kind of progress them, and also keep in mind that they may have injuries or chronic problems long term that we can adjust our training for. It is, for me, the most exciting component of this. It is something that we have to pull our profession kicking and screaming into, and it also has to change the attitude of our profession and all of healthcare that somehow cheapens us. The future of healthcare is going to be a model that has the insurance-based reimbursement that may only be 30% of your practice, and 70% is going to be the prevention and restorative care.